Hello Jennifer. My name is Mahmoud Mohammedan. I'm going to be the student nurse practitioner today. I'm going to do your head to toe assessment, okay?
Okay.
If I should do anything that's painful or cause any tenderness, or if it's just you're uncomfortable with it, just please let me know so I can stop, okay?
Okay.
Well, one of the first things we're going to do is go ahead and inspect the head and face. Just upon inspection right now, I see your facial features are symmetrical. Your ears do line up with the canthus of the eyes. I don't see any redness. I don't see any swelling. I don't see any drainage anywhere, okay? Your skin is warm, dry, and the skin over is intact. So the next thing I'm going to have you do is go ahead and clench your teeth for me. And go ahead and smile. Very good. Can you go ahead and puff your cheeks? Stick out your tongue. Move your tongue left, right, up, and down. Very good. Can you go ahead and close your eyes? Squeeze your eyes tight. Go ahead and wrinkle your forehead for me. Very good. Keep your eyes closed and let me know if you can feel any touching, okay?
Yes. 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 Yes.
Very good. You can go ahead and open up your eyes. Well, cranial nerves, C5, C7, and cranial nerve number 12 are intact. Let me go ahead and, I'm going to go ahead and palpate your facial features. Let me know if you have any tenderness or okay?
Okay.
Any tenderness here?
No.
Can you go ahead and open your jaw? Left and right. Very good. No tenderness was noted over the facial bones. Lacrimal apparatus is non-tender. TMJ, no crepitus is noted. Patient able to move jaw full range of motion, and no clipping was also noted. Okay. Next thing I'm going to do is I'm going to go ahead and look at your scalp. Just looking at your scalp, your hair does appear well distributed. Let me go ahead and just touch this. Let me know if anything hurts. Okay. Very good. So like I said, the hair is well distributed and it is full. I don't feel any masses, lesions. I don't see any drainage. Furthermore, I don't see any signs of alopecia or lice. Okay. Moving on, I want to go down towards your eyes. I see that your eyebrows are well distributed and are symmetrical. I don't see no ptosis noted. Can you go ahead and close your eyes for me and open them again? No lateral ophthalmos is also negative for lateral ophthalmos. And looking at the eyelids, I don't see any crusting. I don't see no swelling, no redness, or no drainage noted. I'm going to go ahead and pull your eyelids down and move them up, okay? Very good. So your sclera is white, your iris is round, flat, and they're both symmetrical bilaterally. I don't see your conjunctiva is clear, and no subconjunctival hemorrhage is noted. Okay? I'm going to have you just look straight at me here. I'm going to shine a light into your eyes, okay? Very good. Pupils are equal, 4 millimeters bilaterally, and round and reactive to light. They constrict with 2 millimeters. I'm going to go ahead and just have you look at this pen light for me and follow me, okay? All right, just go ahead and concentrate on this object for me. Very good. So cranial nerves 3, 4, and 6 are intact. I don't see a positive or papillary accommodation, and no nystagmus is noted. Okay. Next thing I'm going to do is I'm going to have you just focus on an object, focus in the mirror behind me. Go ahead and close one eye, and go ahead and uncover. Very good. Can you cover the other eye? And go ahead and uncover. Very good. No strabismus is noted. I'm going to go ahead and look into your eyes now, okay? What I want you to do is just focus on an area behind here and continue to focus. I will move the light, okay? Very good. Corneal reflex is present. Red reflex is positive. The pondus is visualized. It is orange. Blood vessels are noted in all 4 quadrants. The optic nerve is visualized, creamy yellow, and no AV nicking and no hemorrhage is noted. Okay. And this one here. Again, the red reflex is positive. The pondus is visualized, orange in color. The blood vessels in all 4 quadrants. Pondus is orange. Optic nerve is visualized, creamy yellow. No AV making and no hemorrhages is noted. Very good. Okay? So next thing I'm going to do is I'm going to go ahead and have you, I'm going to cover one of your eyes. Just let me know if you see my fingers move, okay?
Yes. Yes.
Very good. So cranial number 2 is intact, okay? So we're going to go ahead and move on. I'm going to go in, the next thing we're going to do is work on your ears. So just pop in your auricle ectophagus. There is no, it's dry and intact. I don't see any drainage from either ear. I don't see no redness. I don't see no swelling. I'm going to look in your ears, okay? So let me know if anything is uncomfortable. Looking in the right ear, the external auditory canal is pink. No redness is noted, no drainage is noted, no signs of infection. The tympanic membrane is visualized, it's pearly gray. Cone of light is at 5 o'clock, and it's intact. The tympanic membrane is intact. No signs of infection or trauma. Looking in the left ear, again, there is slight swimmer noted. The external auditory canal is pink. No redness, no drainage is noted. The tympanic membrane is visualized as pearly gray. No signs of trauma or infection is noted. And the right ear did not have no cerebrum with no external auditory canal, okay? So the next thing I'm going to go ahead and do is I'm going to have you cover your right ear here, and I'm going to go ahead and whisper some stuff. Just let me know if you can hear it. For the purpose of this video, I'm going to speak a little louder so the audience can hear.
3, 2, 9,
Very good. Go ahead and cover the other ear for me.
8, 3, 5.
Very good. Okay, and the next thing I'm going to go ahead and do is I'm going to do something called the Weber's test. Let me know if you can hear the sound equally in both ears, okay?
Yes.
Very good. Patient's able to hear voices, the sound in both ears equally. Next thing I'm going to do is I'm going to go ahead and hit this next to your ear. Just let me know when you stop hearing it, okay? I'll watch here.
Stop.
Very good. Again, the same thing here. Thank you.
Stop.
Very good.
Stop.
Very good. All right.
Stop.
Very good. So cranial nerve number 8 is intact. AC is greater than bone conduction. So we're going to go ahead and move on to the nose. Looking at your nose is symmetrical in midline. I don't see any swelling or drainage noted. I'm going to go ahead and look in your nose, okay? And again, if I do anything that makes you, if it's uncomfortable, please let me know right away, okay? Okay, look at the nasal mucosa is pink, moist, and intact. The turbinates are clear, pink and moist, and there is no deviation in the right nostril. And the left nostril, again, the mucosa is pink and dry. The turbinates are visualized and are intact and pink and moist, and are clear, and no deviation noted either. Very good. I'm going to give you a couple of other things to smell, just so you know if you can smell them, okay? Go ahead and close one nose for me.
Lemony.
Very good. If you close the other eyes for me. Very good.
Lavender.
Very good. So cranial nerve number 1 is intact. Patient was able to correctly identify both smells. We're going to go ahead and move on to the mouth. Looking at the mouth, just looking at your lips are pink. I don't see no cracking. I don't see no swelling or redness visualized there, okay? I'm going to go ahead and look inside your mouth, all right? You can just go ahead and open your mouth. Please say ah. Very good. And then one. Very good. Sorry. Thank you. Upon evaluation of the mouth, the tonsils are +2, and there's no redness or swelling noted, and there's no white patches. The soft palate and hard palate are both visualized, pink and moist, and then no lesions are there, noted. The teeth are in line and good hygiene is noted. Pinks, the gum line are pink, moist, and there is no bleeding noted from there. No foul odor from the mouth. Also, the uvula did rise with a fontation of awe. Very good. And then cranial nerves number 9 and 10 are intact in the gag reflex. So moving on, we're going to go ahead and go ahead and evaluate your neck. Okay, so I need you to kind of put your neck back, forward, left, right. Can you spin your head 360 there? In the other direction, please. Anything hurt there?
No.
Can you push against my hand as hard as you can? Very good. So no painful, no tenderness upon movement of the neck, and patient neck strength is 5. Okay, we're going to go ahead and just, I'm going to feel the trachea here. First, I'm going to feel the skin is dry, warm, and intact. No masses are noted. Trachea is midline, and no shifts are noted. Okay, I'm going to come around the back. All right, I'm going to go ahead and I'm going to have you turn your head to the left for me. No, I mean, I apologize. And go ahead and swallow. Very good. Can you turn your head to the right side, please? Go ahead and swallow. Very good. The thyroid did rise with swallowing on both times, and no enlargement of the thyroid was noted. I'm going to go ahead and I'm going to palpate your lymph nodes. I will be palpating the lymph nodes of the occipital, post-articular, pre-articular, the tonsillar, superficial cervical, posterior cervical, and the subclavicular lymph nodes. Tender there?
No.
Very good. No tenderness or lymph node enlargement was noted. All right, we're going to go ahead and I'm going to have you shrug your shoulders for me. Shrug them up. Very good. Cranial nerve number 11 is intact. Looking at the chest, the shoulders are symmetrical. Chest rise appears equal. The skin is dry, warm, and intact. I will not remove the shirt for this demonstration, but I have already incensed it, and it is dry, warm, and intact in pink. No masses or lesions or any kind of redness was noted over the chest wall. The front anterior chest wall was noted. I will be listening to the heart sounds. I will be listening in the second intercostal space for the aorta, second intercostal space on the left-hand side for the pulmonic valve. The third space, the third intercostal space for Erb's point, fourth intercostal space for the tricuspid, and the fifth intercostal space of the PMI for the mitral valve. Before I do that, I will go ahead and I will palpate the apex. Very good. No lifts or heaves are noted to the apex. I'm going to go ahead and listen now, okay? I'll be listening for 60 seconds. I will be normally listening for 60 seconds each area. However, for the purpose of this video, we will not be doing that. But I will be listening with both sides, the diaphragm and the bell. Very good. There was no S1, S2 is regular, S3, there was no S3 or S4, no heart murmurs or gulps were noted. Also systolic and diastolic, there was no more murmurs noted there. If I can have you go ahead and lay down on your back. Okay. Can you look to the side here? No jugular vein distension is noted. Can you look to the other side? Very good. Again, no jugular vein distension noted bilaterally, okay? Okay, then have you turn it completely on your right hand side. Just go ahead and stay right there. I'm going to feel the apex again, the PMI. PMI is palpated, +2, non-pounding. Very good. And apex again, no left heaves are noted. I'm going to have you go ahead and set up for me. Again, upon examination of the heart rhythm, S1, S2 is regular, no S3, S4 were noted, and no systolic or diastolic numbers were noted. Okay? We're going to go ahead and continue. I want to listen to your carotid pulses also too. Okay? Carotids are +2 bilaterally. And no carotid roots were noted bilaterally. Okay, next thing I'm going to do is going to move on to your back here. Okay. Well, looking at the shoulders again, they're symmetrical. AP diameter is 1 to 2. AP diameter is 1 to 2. The spine is symmetrical with the scapula. Okay. The back, the posterior back is warm, dry, and intact. There is no masses or lesions. Okay. Chest rise is symmetrical to the posterior back. I'm going to have you go ahead and say 99 for me.
99, 99, 99, 99.
Very good. Tactile firmness is normal. Vibrations were noted throughout the lung field. No dullness and no fluids noted. Okay. I'm going to have you just take a deep breath for me. Okay, go ahead. You in and out, please. Look. If you get lightheaded, please let me know. Very good. So go ahead and relax. Lung sounds are clear throughout the posterior back. No adventitious breath sounds were noted. The next thing I'm going to do is every time I put my stethoscope down, I need you to see E, okay?
E, 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 E.
Very good. So egophony is normal. High-pitched echoing were noted throughout the entire lung field. No consolidation and no fluids were also noted. I'm going to go ahead and listen to your lungs in the front, okay? Anything if you get dizzy or anything, just let me know, okay? Again, lung sounds are clear anteriorly. No adventitious breath sounds were noted. So I'm going to go ahead and move on to your abdomen and have you lay down for me, okay? Very good. All right, for the purpose of this video, I will not be also representing the shirt. One of the parts that I did not go over where the patient was sitting up is I would do a breast exam while the patient was sitting up and lying down. What I'll be looking for when the patient was sitting up is for if the breast is symmetrical and if the nipples are also symmetrical. I would then have the patient raise their hands above their head, and also again making sure there's no dimpling or nipple retraction. And in the case of this patient, there is none. I would have the patient then lay down. Again, I would verify that both breast and the nipple line are symmetrical. I would have the patient raise one arm on either side, and I'll perform a breast exam going in a circular motion, feeling for any masses or lymph node enlargement of the tail of the stents or the subclavicular lymph nodes. In the case of this patient, there were no masses noted bilaterally into the breast, the nipple line. Again, there was no discharge of the nipples, and there were no masses or lesions or redness noted in the breast. Moving on to the abdomen. Again, the abdomen is warm, dry, and intact, and skin torpor is normal and intact. I will be listening to your abdomen first, okay? For the purpose of this exam, I would be normally listening for 5 minutes. In this case, I did not do that, but that would be a normal 5 minutes in each quadrant. In the case of this patient, the bowel signs are normal active. Next thing I'm going to do is going to go ahead and also palpate for the liver. Okay, so the liver is approximately 8 centimeters below the midclavicular line. Okay, I'm going to go ahead and just, I'm going to have you take a deep breath for me. Very good, go ahead and relax. The spleen is not palpable, and no enlargements were noted there. I'm going to go ahead and just lightly touch your abdomen. Okay, let me know if there's any, if you have any pain, okay? Any pain there?
No.
Okay, I'm going to go ahead and no pain or tenderness was noted upon light palpation. I'm going to go ahead and just touch it a little deeper, okay? Let me know if you have anything. Very good. Upon deep palpation, patient does not have any tenderness or masses are noted upon light palpation. Also, no masses were noted. I will also be palpating for the femoral arteries. In the case of this patient, I will not expose, but the femoral arteries I do know have already been assessed, and they're +2 bilaterally. And I would have the patient also bring up the knee just slightly for me. Thank you. I'll be palpating the inguinal lymph nodes, and then there is no enlargement of the lymph nodes noted. Go ahead and put your feet down for me, please. All right, I'm going to have you take a deep breath for me. All right kidney is palpable. It's firm, smooth, no enlargements were noted there. Go ahead and relax. All right, on to the next one. Deep breathe. Left kidney is not palpable, and no enlargements or masses are noted there. Go ahead and relax. I'm going to go ahead and listen to your arteries, okay? Very good. Aorta was auscultated with the bell. No roots were noted. Lateral renal arteries were palpated with the, with the auscultated with the bell. There were no roots noted. Iliac arteries were also bilaterally auscultated with the bell. No roots were also noted there. Femoral arteries were auscultated with the bell again, and no roots were noted there. I will also auscultate the abdomen with the bell too. Again, 5 minutes in each quadrant. And again, the bowel sounds are normal active times 4 quadrants. Okay, while you're laying down, I'm going to have you go ahead and close your eyes for me. I'm going to put some objects on your arms and your lower legs. Let me know if they're dull or sharp, okay?
Sharp, 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 sharp.
Very good. The other one after real quick.
Dull, 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 dull.
Very good. I can go and open your eyes for me. Have you been having any kind of swelling to your lower leg extremities or anything like that?
No.
Any kind of pain?
No.
All right. So go ahead. All right. Very good. Lower extremities. No edema noted to the lower extremities. No redness noted. Can you go ahead and push it against my hand? And push against my hand there. Foot pushes and pulls are positive, +5 under to resistance. Okay, let me take total control of your leg. Just go ahead and relax, okay? No any tenderness?
No.
No tenderness noted with flex or with foot flexed. Okay, very good. Okay. Any tenderness there?
No.
Okay, no tenderness again while the foot is raised and flexed. Very good. The next thing I'm going to have you do is going to have you go and bend your knees, all to the top. Can you roll to the left and right? Very good. And go this way. Very good. Can you go ahead and go out and then come back in again? And then go out again. Out and push out. Very good. Push in. Very good. Go ahead and extend your legs for me. And then don't let me push up. Resist. Very good. And resist against my hand going up. Very good. Again, same thing here. Push down. Very good. And again, go up. Very good. All right. If I can have you set up at the side again for me, please. So lower extremity assessment is, just like I stated before, no swelling, no redness. Range of motion to the lower extremities is strong bilaterally, +5 bilaterally, and full range of motion. Okay, I'm going to go ahead and check your pulses here. Like that. That's radial pulse. On the right hand side is +2, left hand side is +2. Posterior tibialis is +2. And dorsal PDS also +2 bilaterally. Alrighty. Any pain in the shoulders?
No.
Very good. Alright, very good. So no patient denies any pain, shoulder pain, no edema, no redness noted to the shoulders, bilateral elbows, and bilateral wrists. Then I'm going to have you go to put your hands to your side, go over to the back, come over to the forward, and you go up. There we go. Are you able to move your hands 360 both directions? Can you go in the opposite direction? Very good. Any pain or tenderness there?
No.
Patient has full range of motion to the upper shoulders and upper arms. Very good. Go ahead and go like this. Extend. Move your wrists 360. And again this way. Very good. Go ahead and relax. I'm going to go ahead and check the deep tendon reflexes, okay? I'm going to start with the right arm here. Go ahead and totally relax the arm. Tricep tendon reflex is positive and intact. Bicep deep tendon reflex is also intact. All right, very good. Brachial radial deep tendon reflex on the right hand side is intact, okay? I'm going to also go to the left hand side. Deep tendon reflex on the right elbow. Intact. Very good. I'm sorry, deep tendon reflex of the tricep is intact. Deep tendon reflex on the bicep is intact. And deep tendon reflex of the brachial radial of the left arm is also intact. I'm going to move on to the knees here. Okay. Left patellar deep tendon reflex, right patellar deep reflex is intact, and left patellar deep tendon reflex is also intact. Can you go ahead and cross your leg with me, please? Thank you. I'm going to assess the deep tendon reflex. Okay, go ahead. Thank you. Right, can you cross your legs again? Right deep Achilles deep tendon reflex is intact. Very good. And the left deep tendon. Eyes for me. I'm going to go ahead and put a couple of objects in your hands, and this is you can let me know if you can feel them, okay? So the next thing I'm going to go ahead and, what is in your that hand there?
Coin.
Very good. And this one?
Paperclip.
Very good. And then keep your eyes closed, palms open. I'm going to go ahead and draw on your hands. Please let me know what I draw, okay?
8.
Very good.
8.
Very good. While you open your eyes, graphesthesia and streganosis are both intact. Patient was able to correctly identify correct objects in both hands and what was drawn in both hands correctly. I'm going to have you go ahead and stand up for me, please. All right. Go ahead and grab both my fingers, squeeze as hard as you can, and try to pull me towards you. Very good. Go ahead and put your elbows up and then try to resist me from pulling you forward. Very good. I'm going to have you step forward for me a little bit. Okay. Go ahead and touch your toes with your handles. Very good. Come all the way up. Go all the way back. Very good. Can you go side to side, please? Very good. All right. Very good. Any pain there?
No.
Patient has full range of motion of the pelvis. No tenderness or pain was noted. I'm going to have you stand right here. What I'm going to have you do is go ahead and walk to the wall for me. Normally, steady gait is noted upon walking. And I'm going to have you go ahead and walk on your toes all the way back to me. Patient also able to walk on the toes without difficulty. Can you go ahead and walk on your heels to the, there you go. Patient able to walk on heels without difficulty and steady gait, and then walk heel to toe all the way back here for me. Very good. Any difficulty?
No.
Very good. Patient, go ahead and stand right there for me, please. Patient, you can turn around to face the wall for me, please. Patient has steady gait upon all the tests upon ambulation of heel to toe, heel walking, toe walking, and general walking gait is steady. I'm going to have you go ahead and close your eyes for me and just stand there with your hands at your side for 20 seconds, okay? Very good. Go ahead and have a seat. Romberg sign is negative. Please make sure everything. Very good. This concludes the head to toe assessment from Mahmoud Moghadam. Thank you so much.